Hello everyone, hi, Dr. Hatta here again. Today we're going to discuss about does age in the male affect his sperm quality and quantity. Well, there are studies to show that usually the aging male or the older male do have older female partners, and this can lead to difficulty to conceive or difficulty to get pregnant. It is because the aging female or the older female, especially those above the age of 35, the fertility potential is usually decreased. So this is so due to the fact that older men may have older wives, this will lead to the decrease in the fertility potentiality of the couple. However, does the older male himself has problem with his sperm? Well, there are studies to show that the concentration, motility and morphology of a patient or a man who is older do tend to be decreased as he ages. There's studies to show that the concentration or the number of spermatozoa in the semen decreases by 3 to 4% every year. So you can find that somebody who is aged, especially if they are above 50, the number of sperms may decrease. This is also true in conditions where we found out that motility and morphology do decrease as well as you age. And there's a study to show that the volume of the semen also decreases. But all this happens especially if you're above the age of 50, or it starts to happen at the age of 50 and above. So those younger men usually they don't have much problem. Now the question is why this thing may happen. There are many factors. The most common is environmental factor. The older someone is, the more exposure to things like smoking, toxins, vaping, toxins in the environment, things like exposure to gases and radiation and chemotherapy and things like that. All this will lead to decrease in the quality and the quantity of the sperm. It is also true that as a man grow older, there are certain hormonal changes. Even though men do not go into menopause like women, but as a man grow older, the level of testosterone hormone or male hormone decreases. That is why sometimes you have other associated problems like erectile dysfunction, for instance, which may lead to a decrease in frequency of coitus, for instance. So all these contribute to decrease in the fertility of the man itself. There are also studies to show that there may be some defect in the DNA of the sperm in older men. There are studies to show that there are some fragmentation happens in the DNA composition, especially the head of the sperm. So this may lead to decrease in the quality of the sperm, decrease in the ability of the sperm to fertilize the egg, as well as could be increase in the birth defect of the offspring. And also there are studies to show that the older the man, the incidence of abnormal embryonic formation can occur, or aneuploidy, which may lead to increase in miscarriages in the female partner. So what can we do to prevent all this? Number one, of course, do not delay in getting to conceive. Do not delay in getting your partner to get pregnant. Try to get pregnant as soon as possible, as soon as you can, or as soon as you get married. But if you do have a problem, please come and see the fertility specialist. Number two, you may consider things like freezing your sperm or cryopreservation of your sperm so that we can get a good quantity and quality of sperm while you are younger, especially if you plan to conceive later on in life. So later on, we can always use the sperm which being preserved when you are younger to be used later when you decided to have a family. So whatever it is, do not delay your fertility, and there is also an option of freezing the sperm. But you can come and see the fertility specialist and discuss further if you have any inquiries with this. So with that, I think that's all for now. Good luck and thank you very much for listening. Bye.